Miss Kat. How are you doing today?
I'm doing good.
How's your day going so far?
Pretty good.
Awesome. You can go ahead and have a seat here. All right. I'm going to go ahead and put your fridge on. How are you feeling today?
Pretty good. Just have some, I guess allergies.
Allergies? Just seasonal allergies?
Yes.
Yes? Okay. All right, Miss Katz, I'm going to go over your medical history. So it looks like you put down here that you have asthma.
Yes, I do.
Okay, how are you doing today?
The allergies are actually, getting to me.
Okay, what is it that you feel like kind of gets you with allergies?
I think it's the pollen that's, affecting my. Yeah.
Okay, yeah. All right, do you take anything or do you
I
have?
my inhaler, actually.
Awesome, yes, I'll go ahead and take that, put it on the side here. So today, basically, we're just going to go ahead and do your cleaning.
Okay.
Did you have any questions for me?
No.
Okay, so we're going to go ahead and get started. This is Chris, he's my assistant. He's just here to help me, get suction, and, if you need any assistance, he's be glad to help you. I'm going to go ahead and lay you back. It's light. Okay. First, I'm going to go ahead and take a look.
My chest is tight.
Are you feeling okay? No? Okay. Miss Kat, I'm going to go ahead and sit you back up right now. What are you feeling? Can't really talk. Okay, so maybe let's go ahead and get your inhaler. First, can you get me the emergency kit and the blood pressure cuff, please? Go ahead and hold on to this. And go ahead and take a inhale. 1. Wait 10 seconds. And then you can go ahead and do the other one. And okay, meanwhile that's working, I'm going to go ahead and take your blood pressure real quick. Go ahead here. Okay, so that butyrol should have a quick onset. So you should start feeling better. Just seconds. Go ahead and relax there. All right, Chris, I'm going to need you to write down her vitals. I'm going to go ahead and start with her blood pressure. Okay, so we have 139 over 98, and pulse is 74. We're actually going to go ahead and have you sit more right up, and then with your hands forward, please. Are you still feeling a little bit off? Not normal? Okay, just keep breathing. And I'm going to go ahead and take your pulse real quick. Go ahead and lay back. Okay. Relax your breathing. Okay, so for her pulse, I got a 74, and respiratory was at 22. Just go ahead and relax, and we're gonna go ahead and have postpone today's visit, and hopefully next time we'll go ahead and schedule, and maybe do you take any allergy medication? Okay, we're gonna make sure you take that in the morning before you come into your appointment, and always bring your inhaler. And we'll see if we can go ahead and get this done next time, okay? I'm just gonna go ahead and grab your temperature real quick. Okay, you can go ahead and write that down for me. Thank you. Okay, Miss Cat. So since for next visit, just make sure before then you go see your primary care provider. Did you come with anybody today?
My mom.
Okay, awesome. Mr. Chris, can you go ahead and tell admin team to go ahead and let mom know that go ahead and come back here so we can go ahead and dismiss her?
Okay, I'm gonna go make some phone calls in the front office.
Thank you. All right, Miss Cat. So we're gonna go ahead and do that. We can have your mom come in here so she can go ahead and walk you to the car, and she just follow up with us, and then we go ahead and give you a call to see what your primary physician said. Okay. Other than that, you're all good for today. You let me know once you start feeling good, so we can go ahead and dismiss you. Okay. Hello, my name is Brianna, and in our case, I was playing person 1, which I was the hygienist, and I was the one that stayed with the patient. And a type of medical emergency is recommended to have a team emergency structure, which it consists of a person number 1, number 2, number 3, and the office receptionist. For example, the hygienist that is treating the patient will stay with the person and will educate person 2 and 3 to do as follows. 2 is the one that closest to you, whether it's the assistant or the hygienist next door or whoever's the closest available. You would direct them to, for example, record all the vitals, any medications that we give to the patient, the time of the event, and person 3 would be the one, the next available person to retrieve the emergency kit, oxygen tank, any emergency drugs. The office receptionist would be the one calling, making any phone calls, making sure if patient came with somebody to go ahead and dismiss with to make sure they get home safely. In our case, I played person 1, like I said. Person 2 was Chris, and he actually played a role person 3, as well as which he brought the emergency kit, and then wrote down all the vital signs or anything that happened during the time.
Chris, I'm gonna help walk you through the repair protocol for emergencies. With R, it stands for recognize. You're going to recognize the signs and symptoms of someone suffering from an asthma attack. And so that would be coughing, wheezing, shortness of breath, incomplete sentences, chest pain, and just high respiration rate. So next we're going to move on to the repair protocol, which is evaluate. So first we're going to check out her respiration rate. And her respiration rate was going very fast and it was above normal. So once we saw that, we'd have to move to the P in the repair protocol, which is position them. And when we position them for trouble breathing and maybe possible asthma attack, we lean them forward, upright in their chair instead of being supine. We lean them up, and we also put their arms up to take pressure off the chest. And so, as we're checking her breathing, she is breathing a little bit, but if she's not breathing enough, we're gonna have to move into the A part of the repair protocol, and that's activate the air to CPR. So from there, we're gonna check her airway, and we're gonna make sure that she's breathing okay, nothing stuck in her throat, or no phlegm that you might see in there, cause her to stop breathing. And we're also gonna check her blood pressure, and her pulse, and her temperature, see how she's doing. So the next steps after that would be to get to the I part of repair protocol, which is implement appropriate emergency protocol. So in this case, she did bring her medicine for asthma, so we gave her her albuterol. She took her inhaler. She did it twice. One breath was for the first for her first breathing, and then we gave her like a couple seconds to calm down, and up to a minute she can do another one. So after that, finally for the last step of the repair protocol, the R stands for refer. So when we were looking at her patient, she did not want to continue the procedure, and she did want to make sure that she got home safe and wanted to see her primary care provider. So we referred her to see her parent and to see her doctor. some reason, if she just like stopped breathing and we did the CPR and her medicine wasn't working or anything like that, we would have to immediately refer her to the emergency room and get her some EMS.